Aphasia is a communication difficulty. This short video explains what is aphasia and gives some simple tips and tricks to help. Communication is a two-way process. Message in, meaning understanding or comprehension of spoken and written words, and message out, meaning expression, both spoken or written. No two people with aphasia are the same. People with aphasia can have difficulties in some or all of these areas. For example, understanding others when they speak. It may be difficult to read. It may also be difficult to write. People with aphasia may know what they want to say, but may not be able to find the words to express themselves. Sometimes people with aphasia can find it difficult to use numbers and do calculations. Aphasia is typically caused by changes to the brain. Stroke, brain injury, infection, or inflammation of the brain, or a brain tumor are all possible causes of aphasia. There is also a condition known as progressive aphasia. Most commonly, stroke is the cause of aphasia. This is due to an interruption of blood supply to the brain, and the brain tissue becomes damaged as a result. Usually, it is damage to the left side, where the language and communication centers are found. Aphasia can impact a person's everyday life. Having a conversation, for example. Some people with aphasia find group conversations particularly hard. Using a mobile phone and making calls or texting can be a challenge. Reading, writing, and using a computer can also be difficult. However, everyone with aphasia is different. Having aphasia can be difficult for the person themselves and for their friends and family. It can be confusing as it is invisible and difficult for others to understand. People with aphasia may be lonely or isolated. It can help to meet others in the same situation, for example, at an aphasia cafe, or speak to your local speech and language therapist about any communication groups which may be going on. Family and friends may often ask how they can help someone with aphasia. It is important to remember that somebody with aphasia is an intelligent adult who knows what they want to say. They can make their own decisions. People with aphasia know what they think and feel and what they wish to communicate, but they may struggle to comprehend the conversation, to find the words, or to formulate the sentences to express themselves. Speech and language therapists are skilled in the assessment, diagnosis, and treatment of aphasia. It is a good idea to take time to talk to your local speech and language therapist to see how they can support you to live well with aphasia. Family members and friends may also ask how they can help somebody with aphasia. First of all, ask the person themselves, what helps? They are experts in their own communication ability. When someone has a physical difficulty, we often think of ramps to support them to access a building. We can also use the analogy to support communication and communication ramps. This means making the environment and our own communication, be it written or spoken, accessible to people with aphasia. While everyone with aphasia is different, here are some simple tips to support communication. Take time. Slow the pace and be patient. Try not to rush the conversation. Keep it to one topic at a time before moving on to the next topic. A quiet environment can support communication and enable people to focus on what is being said. Writing down key words can help comprehension. Drawing pictures or diagrams can help the person with aphasia to express themselves or support comprehension when the other person is also drawing the key words. At the end of the conversation, it can be helpful to recap. Check that you've both understood and you are on the same page. If you wish to learn more about aphasia, visit the Irish Association of Speech and Language Therapists website. There you will find more information, videos and resources for people with aphasia.